move has sparked controversy in Queensland, Australia, as the Gympie Regional Council votes to remove fluoride from the town's water supply. This decision has sent shockwaves through the health community and reignited a heated debate. The fluoride debate, a controversial choice. In a surprising turn of events, the Gympie Regional Council has decided to scrap fluoride from its water supply, following a year-long internal debate. This move comes after 15 years of adding fluoride to the region's water, a practice supported by major health organizations like the Australian Dental Association and the Australian Medical Association. But here's where it gets controversial. In 2012, Queensland granted individual councils the power to choose whether to fluoridate their water. Now, Gympie has joined the ranks of Cookshire Council, which made a similar decision in February, and Cairns Council, which voted against reinstating fluoride in December last year. The cost of fluoride, a financial perspective, of Queensland's 77 local government areas. Only 23 have fluoridated water, yet the majority of the state's population has access to it due to the fluoridation of the entire southeast region. Gympie councillors voted 5-3 to end fluoridation, a decision that Mayor Glenn Hartwig claims will save ratepayers a significant amount, approximately $255,000 annually. Mayor Hartwig argues that if the state wants to mandate fluoride, they should also foot the bill, adding that the council's decision is not pandering to conspiracy theorists, but rather a respectful conversation in a democracy. Expert opinion. Alarming concerns. Michael Foley, a dental expert from the University of Queensland, strongly criticizes the council's decision. He emphasizes that water fluoridation is a no-brainer in public health, saving vastly more money in dental treatment costs than its implementation. Almost every town and city in Australia outside Queensland drinks fluoridated water, and it should be a state government responsibility, as it is in every other Australian state. Dr. Foley said he sympathizes with the council's financial constraints, but believes this decision was not in the best interest of the community's oral health. For the children, a parent's perspective, Hazel Watts, a local resident, expresses shock at the news, emphasizing the importance of fluoride for children's dental health. She believes the decision should have been left to the federal government, considering the expense of dental care. Councillor Alona Lawn agrees that locals should have a choice in their water composition, citing examples of countries like Europe that do not add fluoride. She believes the science is not yet settled and that, like smoking and asbestos, future research may prove fluoride to be less safe and effective than currently believed. Political fallout. A divided opinion. The decision has sparked a political debate, with opposition leader Stephen Miles expressing deep concern. He blames Premier David Crisafulli, the former local government minister who put this responsibility on councils, for the potential oral health issues that may arise. However, Deputy Premier Jared Blagey defends the council's right to make decisions on behalf of local residents, stating that it is proper for councils to represent their communities and make such choices. Miles argues that $255,000 is a small price to pay for the oral health of young people, and that removing fluoride will result in a much bigger bill for the public oral health service. He encourages Queensland Health to step in and fund fluoridation, as it would have been done under a Labor government. A resident's relief. A personal perspective. Anne Robertson, a local resident, believes fluoride is a carcinogenic chemical byproduct and has been filtering her water. She praises the council's decision, stating that it is wonderful and beneficial for everyone. The process of removing fluoride from Gympie's water supply is estimated to cost $100,000 and will take at least a month to complete. And this is the part most people miss. The impact of this decision on the oral health of Gympie's residents, especially children, remains to be seen. What do you think? Should the state or local councils have the final say on water fluoridation? Share your thoughts in the comments below.